Institute of Dental College, affiliated under Tamil Nadu Dr. MGR Medical University. My father is retired branch manager from Oriental Insurance Company, and my mother is a homemaker. And my spouse is working in a public sector undertaking. He's working in the Punjab National Bank as a marketing officer. And soon after my graduation, I started with my clinical practice as an assistant in one of my seniors' clinic. And since insurance has been a part and parcel of our life since father was working there, interest in insurance field was there from the childhood days. So, but alongside the practice, I started gathering information about all these insurance and banking exams, and I took a brief year of a 1 year break in between for marriage, and later I quit my practice in 2024 and started focusing my preparation entirely towards banking and insurance sector. And for past 1.5 years, I'm preparing solely for this.
Dr. Keerthana, why did you join dentistry?
So science has always been an interest from childhood days. I opted for either MBBS or in the field of BDS. So since I couldn't get into MBBS, I joined BDS, sir. Dentistry.
So you shouldn't see. You told that insurance was in your bloodline only, and you were very interested in insurance only. Then
Yes.
Why did you did BDS? You should have done BA, BCom, or LLB. Generalist insurance are also there.
Yes, sir. But since science was, I took major as science in my higher secondary. So I entered through that and got to know about health insurance only after during my college days. So I got more interest in health insurance after joining the medical profession.
So how your BDS knowledge will help us? As you know, the dental treatments are already excluded. The things you have studied for 5 years are excluded.
Sir, I wouldn't take it as it's excluded since we studied all basic general medical professional subjects right from first year till final year. So theory knowledge would help me sustain through the health insurance field, sir. So I wouldn't say it would my entire BDS industry degree would be excluded.
Dr. Keerthana, are dental treatment included in insurance?
Dental treatment which under anesthesia or involving any accidents or injuries are covered, sir, basically.
Veneers treatment, are they included?
No, sir. Since it is a cosmetic procedure, it is not covered under insurance, sir.
You don't like practicing on patient rather than you love these files and desk job?
No, sir. Since I was practicing for the last few years, it gave me professional satisfaction, but always.
Or you are not confident enough to treat patient?
No, sir. I even have documentation of patients whomever I have treated previously and their positive reviews on how I treated them and their things. So I wouldn't say I'm not satisfied with my practice, but since my goal and bloodline was through interest in
so won't be it's a waste of your talent?
So I wouldn't say it is a waste of talent, sir. So practice, in fact, gave me more responsibility in taking in decision making and also the importance of health insurance for each and every individual. So I wouldn't say it is a waste of knowledge, sir.
What's the government policy for health insurance for each and individual? Insurance for all 2047, what it is?
Yes, sir. It is Pradhan Mantri Jan Arogya Yojana launched by our Honorable Prime Minister. It involves health insurance scheme around 5 lakh per family.
What was the budget? What was the budget allocated?
5 lakh rupees per family, sir.
Budget. Day before yesterday, budget came. What was the budget allocation for Ayushman Bharat Yojana?
Sorry, sir. I didn't.
Do you know anything about Biopharma Shakti?
Biopharma Shakti? No, sir.
It was in budget only?
No, sir. I haven't read about.
Okay, Paripurna Mediclaim Ayush Bima.
Yes, sir. It is an insurance policy offered by New India Assurance. Currently, I couldn't recollect the exact.
Okay. Ayush Bima. Do you know anything about Ayush Bima?
Ayush Bima? No, sir.
Okay. Tell me a few diseases which are autoimmune in nature.
Sir, autoimmune includes rheumatoid arthritis, in gastrointestinal, it may be Crohn's, ulcerative colitis, there is irritable bowel diseases, and
tell me some STDs.
STDs, sir, it includes syphilis, then gonorrhea, then sexually transmitted. Hepatitis. One of the hepatitis variants is, can also be sexually transmitted, which is
Which
hepatitis.
hepatitis variant are fecal-oral?
Fecal-oral is hepatitis A and E, sir.
Okay. Name the bacteria which causes dengue.
Sorry, sir. Currently couldn't recall it.
It's okay. Upma ma'am.
Hello, doctor.
Hello, doctor. Good evening.
So you are from Chennai, right?
Yes, ma'am. Currently, I'm residing in Chennai.
Okay. So do you know where is New India's office?
It's in the Anasa branch. As I live in Tenapet, it's very nearest to my residence, ma'am.
Only one office is there, or other offices are also nearby?
As far as I know, I have seen one office in the main street of Anasa, and I haven't been to much around since I'm new to Chennai. I have been around the area.
So how long have you been living here?
For almost 6 to 7 months, ma'am.
6 to 7 months. Okay. What is TPA, doctor?
TPA is third party administrator in insurance. They usually they act as a bridge between the hospitals, insurers, and the insured. They help in processing the claims given by the insurance companies, hospitals, and the insured persons.
Can you name some TPAs?
TPA's names I don't know. I'm sorry. I'll read upon it.
Okay. Okay. Tell me, what is GPLA? The term that we use in gynecology. GPLA.
GPLA. No, ma'am. I'm not aware of it. No,
okay. Tell me something about pneumothorax.
Sorry, ma'am.
Pneumothorax.
Pneumothorax. Can I make a guess, ma'am?
Yes, yes, sure.
Pneumothorax is I think it's a sudden fluid buildup around the lungs.
Fluid buildup. Then what is pneumonia?
Pneumonia, it's an sorry, ma'am.
Pneumonia is bacterial or viral disease?
Ma'am?
Pneumonia is a bacterial or viral disease?
Pneumonia is a bacterial disease.
Which bacteria causes? Bacteria name?
Sorry, ma'am, couldn't recollect it. I've read about it, but I couldn't.
So you have practiced also for 2 years, right?
Yes, ma'am.
What all procedures have you practiced? What all procedure you were doing? General dentistry or specialization also?
No, ma'am. I have done all procedures in general dentistry, ma'am. From right from prophylaxis, then root canal treatments, basic restorations, and common surgeries, including removal of tooth extractions. And
have you done impactions also?
I've done a very few cases of only vertical impaction, ma'am. Since
okay.
I am not specialized in that.
Okay. Okay, so we use the local anesthesia, right? So which local anesthesia you use is in a hypertensive patient?
In hypertensive patients, we use lignocaine without adrenaline.
Why?
Because adrenaline causes vasoconstriction, which in turn causes rise in the blood pressure. So we use lignocaine without adrenaline for hypertensive patients. Okay,
tell me 3 conditions where adrenaline is contraindicated.
One is hypertensive. The other one is, I think, stroke. That's all I could remember.
What about hyperthyroidism?
Hyperthyroidism is caused by. Sorry, ma'am. Are you asking about
yes.
adrenaline in
yes.
hyperthyroidism?
Yes. Will you use?
No.
Will you use clean LA or?
No, ma'am. LA without adrenaline is used in hyperthyroidism.
Okay. What is CKD?
CKD is chronic kidney disease, which is caused due to long-standing defect in the kidney filtration, and the glomerular filtration rate is usually more than 60. That is in contrast with the creatinine. Usually, whenever the creatinine is less, the glomerular filtration rate will be higher, and vice versa in kidney diseases.
So, in a CKD patient, what will be the creatinine level?
CKD patients' creatinine level will be low since glomerular filtration rate is higher.
What is the range?
One.
What is the normal range for that?
Sorry, ma'am, I don't know. I'll read about it now.
Okay. What do you know about autism?
Autism, it is an neurodegenerative disorder characterized by people who are not able to interact socially, and they cannot make eye contact with people as normal people do. It is just a condition without a proper cure, but life expectancy is similar to the normal people with
Is it
proper.
a genetic condition? Is autism genetic?
I think yes, ma'am.
Okay, what is the treatment for autism? How will you treat an autism child?
There is no particular treatment for autism or complete cure for autism. Behavioral changes and socializing changes are
Like, can we go for a speech therapy in a case of
yes,
autistic child?
therapy in cases in speech therapy, and in case of involuntary movements, they can go for physio help.
Okay. What is obstructive sleep apnea?
Obstructive sleep apnea is caused due to the blockage in the nasal septum, and mainly found in children's. That's all I mean.
Are you sure about this? Obstructive sleep apnea is mainly found in children. Is it because of blockage? Are you sure? Okay, what is DNS?
Sorry, ma'am.
DNS.
DNS is deviated nasal septum, which is a physiological, not a physiological, but it's physically the deviation of nasal septum, either due to some common injuries. It can happen after any sport injury or accidents like that, or it can be due to congenital nasal septal defect.
How will you treat DNS? Can it be treated with medicine only, or would it require surgery?
In case of blockage of nose due to deviated nasal septum can be treated with medications, but in case of cosmetic appearance wise, it has to be treated surgically.
Which medication you will use?
Corticosteroids, nasal sprays.
If it is deviated, this is an anatomical defect, right? How will you treat it with medicine? It will not make it straight.
No, it is just for the blockage of nose due to the nasal septum. It won't correct the nasal septum deviation. The correction of nasal septum deviation properly requires a surgical intervention.
What is the surgery name that we do for DNS?
I guess it is septoplasty, ma'am.
Septoplasty or rhinoplasty?
I think it is septoplasty, ma'am.
Even what is rhinoplasty?
Rhinoplasty, I'm not aware of it, ma'am. I'm sorry.
Okay, doctor. Okay, sir.
Keerthana, your husband is also in a PSU sector, right?
Yes, sir. Yes, sir.
What if we post you to the North India and your husband in South India? How will you manage?
Sir, since I came from a clinical practice, this has always been an what to say, our part and parcel of our daily routine. Since initially he was placed in Coimbatore, and now we have transferred to Chennai. And in case of government employees, we do also have an option of familial background, and wherever the spouse resides, we can apply for that transfer based on that residence. So
But can you adjust the cousins and language?
Sir, sorry, sir.
Can you adjust the cousins and language? Just think I am sending you to Delhi, New Delhi.
Okay, sir.
So will you be able to speak Hindi?
Yes, sir, definitely. I have the confidence. Maybe so since coming from professional background, this was insurance exams itself was Greek and Latin initially, but as I learned through the process, I get to know the pattern and how to approach it. So learning is by default, so I can learn.
आपके father retired हो चुके हैं कि अभी भी हैं job में?
He is retired, sir. He got retired in 2021.
Okay. I'll ask few short forms of medical terminology. Can you answer them?
Yes, sir. As far as I know, I'll answer.
DNC?
DNC is dilatation and curettage.
ERCP?
ARCP. No,
URSL? URSL?
Erythrolithotripsy.
ESWL?
No, sir.
TKR? CABG?
Chronic coronary artery bypass graft. Sir.
COPD?
Chronic obstructive pulmonary disease.
USG?
Ultrasonograph.
PID?
Pelvic inflammatory disorder.
PCOD?
Polycystic ovarian disease or disorder.
Very good. Vinit sir?
Good evening, doctor.
Good evening, sir. Good evening.
So what was your goal?
Sir, right now or
As into why are you joining NICL? Why do you want to join NICL?
sir, as said earlier, the importance of insurance has always been taught from my childhood days, and since I have a clinical medical professional background, I decided to join the health insurance sector, sir.
Did you give any other exam?
Previously, I've given Oriental Insurance exam last year. The same health officers vacancies was available, and I did attend the interview, but I didn't get through it, sir.
So basically, your goal is to join the insurance industry, right?
Yeah.
So it can be public or private, doesn't matter, right?
So focus is mainly towards public sector.
Why?
Sir,
Private ones are doing quite well. They also have their branches everywhere.
sir, since medical background itself is a service-oriented career, public sector is also towards more service-oriented and framing health policies for also the underprivileged and service-oriented. So that is why I chose public sector, sir. Mainly because of the size.
Even the private ones do that nowadays. Anyway, you will be sitting on a desk. You won't be on the ground. So you won't be serving the public. In fact, you might be rejecting the claims.
Sir, it is because of the policy forming regulations which are more transparent and ethical in a public sector institution, I think.
If that was the case, then all the private ones would have been closed. But they are, Ankit sir, they are better than us, right?
Yes, actually they are better than us. Even you ask any common person, they'll say I've taken HDFC Ergo or Star Health.
Yes, they will tell you. What will you do in that case? I'm just asking if you want to join insurance, and even they are getting they might be even getting they might give you better perks, better salary.
Sir, one possible reason is long-term career growth and stability, which I cannot assure in private sector field.
Okay. So NICL comes under which ministry?
Sorry,
It
sir.
works under which ministry? You can take a guess if you want.
Under Ministry of Finance or I think under Ministry of Finance.
You're not sure. Okay, no problem. So what is the health market share of NICL?
Sorry, sir, I don't know. I'll read about it, sir.
Okay. The total market share in the insurance industry that NICL holds?
Total market share. I don't know. Is it around 48%, sir? I'm just making a guess.
That is too much. 48. If NICL would be 48, then no problem. So what does an AO do basically?
Sir, the role of an administrative officer is to mainly involve in administrative processes like underwriting, pre-authorization, and fraud detection, processing of claims, and that's all I know.
Okay. Do you know the full form of GWP?
GWP? No, sir. I'm not aware of it. Sorry, sir.
Okay. Basically, it is gross written premium. What could it be?
Gross written premium, maybe the initial process when an insurer or customer, insured person or any customer ask for a policy, the gross value of the premiums is given.
Okay. What is claim settlement ratio?
Claim settlement?
Ratio.
Sorry, sir, I couldn't recall it. I read about it, but I just couldn't recall it.
No problem. What is free lookup period?
So free lookup period is usually for 15 days, wherein the insured can review the terms and conditions of the policy and reject if it is unacceptable to them. That is a free lookup policy. Free lookup period.
Okay. What do you know about mis-selling? Selling.
Maybe the I'm just taking a guess. Mis-selling is a wrong issuance of any policy products.
Okay. Do you know the principles of insurance?
Yes, sir. There are 7 principles of insurance. First is being the utmost good faith, insurable interest, contribution, subrogation, causa proxima, loss minimization, and insurable interest.
What is utmost good faith? There's a word for it.
Yes, sir. I couldn't pronounce it now. Sorry, sir.
Okay, okay. Causa proxima, what does it mean?
Causa proxima is the near possible reason for any accidents or any possible nearest possible cause should be taken into account for the claim processing. Sir.
Okay, okay. Netam sir.
Keerthana, selecting you, as you said, your father is also a insurance officer. Okay.
Yes.
Selecting you won't be a nepotism.
Sir, no, sir. Maybe what I would categorize is if he is still working in an insurance or a present employee, maybe people can consider it as a nepotism. But this is purely because of my interest and through I passed through two prelims and the mains examination, which probably decided the merit marks of my.
Do you
knowledge.
have child?
No,
Do
sir.
you have,
Not yet.
do you know anything about maternity benefits?
Yes, sir. Maternity benefits is an add-on cover in health insurance, wherein the waiting period is around 36 months.
Okay. Nityam sir.
Hi, sir.
So, Dr. Keerthana, you tell me, what are the general exclusions in the insurance? And do you know the examples of any general exclusions?
General exclusions. Sir, any accidental coverage basically starts from the day one. Other than that, normal waiting period of 30 days is indicated for, I think, lifestyle diseases, and exclusions include any cosmetic procedures and any pre-existing diseases. Pre-existing diseases should has an waiting period of 3 years. Previously, it was 4 years. Now it has been reduced to 3 years. I think these are the exclusions.
Dr. Keerthana, what are corporate policies in insurance? Do you have any idea?
Sir, I've read about it. Can I take a guess, sir? Corporate policies include group insurance for the benefit of their employees working in an institution.
Right, very good. So, how these policies differ from the basic general policies?
So general policies is available as an individual and floater policy, whereas in corporate it's available only as a policy.
Tell me, are the waiting periods or non-disclosure clauses applies on these policies or not?
Sorry, sir, I'm not aware of it. I'll read about
Okay, no issues. Now tell me, what are daycare procedures?
Daycare procedures, sir. Daycare procedures which require hospitalization less than 24 hours. Then daycare procedures include cataract, then long-standing dialysis, hemodialysis patients, and
Good. So tell me, what are waiting periods and what exactly the waiting period for the cataract surgery?
so waiting period of cataract surgery, I think it is 2 years, sir.
Dr. Keerthana, who regulates all these general insurance companies? Are there any regulatory body?
IRAI, Insurance Regulatory Development Authority of India, which functions as a regulatory authority for all the insurance-related products and all. It's an authoritative for insurance in India. It was formed in 1999 under the IRAI Act, formed by the R. Malhotra Committee. And the functions of IRAI usually includes regulating the premium and making sure transparency, framing new regulations, approval and authorization of insurance companies. Those are the functions of IRAI.
So as we know that dental treatments are not covered under these policies. So I want to know, are these Ayushman treatments covered under the policies?
Ayush treatments, yes, sir, it is covered. It is covered, 100% covered.
So do they have any sublimits to which these Ayushman treatments are covered, or are they covered up to the sum insured?
Sir, I think there is no supplements for Ayush.
So basically, you want to say they are covered up to the sum insured. So may I know what do you understand by the sum insured?
Sum insured is the maximum amount of the policy. I think I just wouldn't remember, sir.
No worry. So tell me, what do you know about the appendicitis?
So appendicitis is the inflammation of the appendix, which is present in the lowermost part of the intestine. Inflammation is the reaction caused due to the reaction of damage caused due to our immune response reacting to an infection. That is inflammation, and appendicitis is in that
Very
area.
great. So tell me, what is CAG?
Sorry, sir. I couldn't
It
recall.
is basically an investigation, that is coronary angiography.
Angiography.
Now tell me, when is this test done, and usually what does it tell?
Coronary angiography. It is, sir, is it other? I'm just taking a guess. Otherwise known as angioplasty or?
No. Angioplasty is a surgery. Before angioplasty, usually the CAG is being done to evaluate how much blockage is in the coronary arteries. Okay.
Okay, sir. Sorry, sir. Not aware, but I'll read about that.
No issue, doctor. So now tell me, what is moratorium period in the insurance?
So, moratorium period is a period wherein initially it was 8 years given by the IRA. Now it has been reduced to 5 years. After the period after which a claim cannot be rejected due to misinterpretation unless it is due to any fraudulent activities. Yes. Yes. No, sir.
Now tell me, what are the PPNs? Basically, what are network hospitals?
Network hospitals. Sorry, sir, I haven't read about it. I'll read about it.
So, Dr. Keerthana, can you please name any other PSU insurance selling companies apart from this NIACL?
Okay, so one is Oriental Insurance Company Limited, the other one is United India, there is National Insurance, and there is one reinsurance company, there is Gen.
So, which company is at the topmost position as far as retail policies are concerned?
Which company is it? In the general insurance levels or
No, in health domain basically.
in health insurance, along with health and motor, New India's top insurance.
Yes, definitely it is correct that NIACL is the top leadermost company, but I am talking about the retail segment. So, as far as retail segment is concerned, which companies lies at the topmost position?
LIC, sir.
In the health policies in retail segment.
LIC, sir, Life Insurance Corporation.
No, it is actually Star Health.
Okay, sir. Okay.
So, what is turnaround time in the insurance?
Turnaround time. No, sir, I'm not aware of it. I'll read about it, sir. Yeah.
So, tell me, what is co-payment?
Co-payment, sir. Co-payment is a part of the payment the insured person must pay in addition to the insurer in case if an claim amount of 2 lakh rupees is given and 10% co-pay is fixed, the insured person should pay the 2 lakh and the rest will be paid by the insurance company, sir.
So, what is deductible in the insurance?
Deductibles, apart from deductibles comes the co-payment, whereas deductibles are the payment which are the payment portion of amount which the insured must pay before processing the payment, before the payment processing by the insurance company, sir.
Okay, that's fine. So, as you said that patients have to bear a certain amount of their expenses. So, opting this will be a customer centric. I mean to say that if a patient opts for the deductible or any kind of co-payment, so what benefit do they get?
The customer gets benefit. Sorry, sir, I'm not aware of it.
Okay, no worry. So, tell me, what are the waiting periods in the insurance?
So, waiting period mainly applies for treatments which are elective. Since elective is an on an appointment basis, which are not any emergency cases, the waiting period is applicable, sir.
Can you tell me why patient have to wait for a certain amount of time? Why these waiting periods are introduced in the insurance? Why patient have to wait?
No, sir. I'll read it.
No issues. And so, Dr. Keerthana, now tell me the most common grounds on which the claims are usually rejected. The most common reasons. Tell me,
Okay.
can you name any 5 or 4 reasons?
Okay, sir. The main possible reason would be missing of any needed documents given by the. Okay. Misinterpretation of.
Yeah, definitely, it is one of the reasons. But I want to know the most common reasons, most common grounds on which claims are usually rejected. Do you know the ND or PED, non-disclosures or pre-existing
No, sir. I haven't read about it. I'll read about it, sir.
What are the enemies in insurance?
No, sir. I'm not aware of enemies, sir.
Keerthana, do you know anything about Bima Trinity?
Yes, sir. Bima Trinity is an exclusive scheme introduced by IRDAI, which includes 3. One is Bima Sugam, one is Bima Vistar, and the other one is Bima Vahak. Bima Sugam is an all-in-one digital platform for all insurance-related activities can be carried out in that one single portal. And Bima Vistar is an digital. It is like a product which offers comprehensive package for comprehensive insurance package. And Bima Vistar is insurance awareness.
Bima Vahak is woman.
Yes, sir.
What is Bima Bharosa?
Bima Bharosa is grievance redressal portal by IRDAI.
Do you know anything about Arogya Sanjeevani?
Yes, sir. Arogya Sanjeevani policy is mainly specifically customized for senior citizens. Health insurance.
Okay, you are very close to your father. Your father must have told there are common frauds in health insurance. Can you tell which common frauds are there?
Common frauds include, sir, moral hazard, because people once after they get insured.
I am asking common frauds.
Sir, does moral hazard comes
Okay,
under
one is moral hazard, other?
Overbilling by the hospitals.
Hmm.
Then that's the 2 things I can remember right now, sir.
Okay, answer me one last question. Okay,
Yes,
see, you are given OICL also. Okay, and you are not selected there.
Yes, sir.
Right. Then why NICL should select you?
Sir, when I was giving OICL exam, I was at a very beginning stage. Maybe I would say I was a novice that time. Since the weightage of the marks we secured in the mains exam also plays a role in that. Maybe I just cleared my mains exam in nearly 4 to 5 marks difference in the lead. So maybe my interview marks, since mains exam carries 80% weight and interview carries 20%. Candidates other than me would have scored higher scores in the mains examinations. So I would have.
Okay, Keerthana, very good.
Okay,
it was very good interview, and you are very well prepared. Only one thing you have to do. Can you just go there, go outside, and come inside and tell, "May I come in? May I sit?" How you do that gesture? Can you do that now?
Yes, sir, sure.
Yeah, you can come.
Excuse me, sir, may I come in?
Yes.
Good evening, sir.
You can sit.
Thank you, sir.
Keerthana, it was good. Even ma'am was also there, so you have to wish her also. Just
Yes,
make sure if there is a lady panel, you have to wish her also. Okay.
Yes, sir. Yes.
And just disconnect. In 5 minutes, we'll reconnect. We all panel members have to discuss about your interview,
Okay,
and
sir.
we'll reconnect and tell you. Okay.
Sure, sir. Thank you, sir. Thank you, ma'am.
Yeah. Hello, Dr. Keerthana. See, you are a very good candidate. Actually, very good. You have a very good hold in language also. You are very confident. Your outlook is good, and you look very dedicated person also. Like to be hired in a PSU.
Okay, sir. But I got quite anxious, sir.
No. See, the thing is, we take very extensive and on a tougher side the interviews. Okay, those interviews will be like a chit chat and like 15 minutes maximum. Okay,
Okay.
so just relax. Okay. Only thing is insurance part you have to study a bit. Okay, and one more thing I wanted to tell one thing. You cleared IBPS also. Okay.
Yes, sir.
Right. Don't mention here also. You didn't mention there also. Please don't mention it. Okay. Just say OICL. That looks that you are very interested in insurance field only.
Okay, sir.
Upma ma'am.
Doctor, I think your medical part was fine only. Just two things I will tell. One, you read about autism,
Sure.
and that's obstructive sleep apnea.
Yes.
You told that it's found in children more commonly. That's not correct. You read about it.
Yeah, sure.
And GPLA also you read.
Okay, ma'am.
Rest
Can I
was fine. Yeah. They will give you this recording. You can see this. This
Okay.
exhibit recording will be given to you.
Okay, ma'am.
You can write it down also.
Yes, sir, you can write down. You can
Yeah,
write down.
GPLA, pneumothorax.
Yes, ma'am.
Autism and obstructive sleep apnea. Rest answers are fine only. I also felt you're very confident and everything is great. Just you need to brush up one time. The PDF that they have given you now, you just see that once.
Yeah,
When you
sure.
can interview,
On Monday morning at 8:30.
so you have time 2 days. You can go. That is in Chennai only.
Yes, ma'am. Chennai.
So what are you going to wear? Same outfit?
No, ma'am. I have another pearl white plain Govt with an full set shoe set, ma'am.
Okay, and footwear?
Footwear is formal shoes, ma'am. A beige color shoe.
Shoes like bellies, right?
Yes, ma'am. Bellies.
Then it's fine. Keep your hair tight like that and then it's fine. Okay, all the best.
Okay, ma'am. One more thing you told about pneumothorax, autism, sleep apnea, and one more.
GPLA.
Okay, ma'am.
GPLA is a term that we used in gynecology to take the obstetrician history.
Okay.
G is for gravida, P is for para,
Okay.
L for live birth, and A for abortion.
Okay, ma'am.
Okay, you just read about it.
Sure, ma'am. Thank you.
Vinit sir.
See, your answers are good. You are, as Ankit told, you are a great candidate. Only the insurance part, I think they need to work a bit. Like, utmost good faith is overime fide. That those, just read those, all right. And NICL functions under Ministry of Finance.
Okay, sir.
In case they ask you, just remember it. Then the health market share, just read about the market share position of NICL.
Okay,
The
sir.
total market share, the health market share.
Okay, sir.
Then ownership of government, how much government holds, how much shares does the government hold in NICL.
Okay.
So then the non-disclosure that Nitams are asked.
Yes, sir.
Claim settlement ratio is important. What is the claim settlement ratio?
I
Okay,
just.
only otherwise you did great. And as Ankit mentioned, don't mention about IBPS or anything.
Yes, sir.
Just mention about OICL. That is fine.
Also, Keerthana, one thing I asked you that we transfer you to the North India.
Yes,
Can you
sir.
speak in Hindi? And I just you next question I said in Hindi only.
Yes, sir.
So if possible, you know Hindi, then you answer in Hindi at that time. Okay. Maybe it is just a test. I was just testing you. Can you speak in Hindi? That's why the next question was in Hindi.
Okay, sir. The thing is, I
You're
can
comfortable.
a little bit of English, but I don't have the confidence to converse in.
It's okay. Then continue with your language only.
Okay.
Nityam sir.
डॉक्टर कीर्तना अनडाउटेडली यू आर वेरी नाइस कैंडिडेट बहुत डेडिकेटेड कैंडिडेट हो आप बस थोड़ा इंश्योरेंस के बारे में बेसिक पढ़ना होगा आपने आंसर्स बहुतों के कर दिए थे लाइक मैंने आपसे पूछा था कि वेटिंग पीरियड्स क्या होते हैं सिग्निफिकेंस क्या है इनका क्यों इंट्रोड्यूस किए हैं ठीक है तो इसके बारे में थोड़ा जान लेना और फिर मैंने आपसे पूछा था कि डिडक्टिबल्स ऑफ ओपी का क्या फायदा मिलता है पेशेंट्स को तो इससे ना प्रीमियम कम हो जाता है पॉलिसी ऑफ करते हो खरीदते हो ठीक है इसके बारे में पढ़ लेना और फिर मैं पूछा था कि मोस्ट कॉमन ग्राउंड्स ऑफ क्लेम्स आर यूजुअली रिजेक्टेड तो इसके बारे में ये पढ़ने से पहले आपको ये जानना होगा कि एनडी क्या होता है नॉन डिस्क्लोजर्स क्या होते हैं इन्हीं के बेसिस पे सबसे जो क्लेम रिजेक्ट किए जाते हैं तो नॉन डिस्क्लोजर्स के बारे में पढ़ना प्री एक्जिस्टिंग डिजीज के बारे में पढ़ना बाद बाकी आपको सब पता है कॉर्पोरेट पॉलिसी पता है टेक प्रोसेस पता है मोरेटोरियम पीरियड पता है ऑल फाइन
Keerthana, how was your mains?
Sir, means I've given an account of around 115 questions.
And what accuracy you are expecting?
Accuracy, I'm expecting it around 80 to 85%, sir.
Okay, so you will be selected. Just go and do the interview like this way only. You will be selected.
Sir, any other question I have to improve myself?
No, you don't need to improve. Just be yourself only. You will be selected.
डॉक्टर
Sir?
कीर्थना आपने ओआईसीएल का इंटरव्यू दिया था जब आपसे क्या क्या क्वेश्चन पूछे गए थे कोई आपको क्वेश्चन याद आ रहा है इस वक्त
It asked for barely for around 5 to 7 minutes only. So they were asking about Ayushman Bharat scheme and the medical portion. They asked me about complete.
Read about the budgetary allocation also. I think you were not able to answer.
Yes, sir.
The Ayushman Bharat.
Okay, sir.
And in medical, what they asked?
Medical, they asked about a complete blood count and where all it is indicated and what all the tests coming under complete blood count. And they asked me about sickle cell anemia. That was only the medical part, sir. And other than that, they asked about only the Ayushman Bharat scheme around about the insurance part and I think around the health claims related questions only they asked. Probably 8 to 5%, sir. Insurance part mainly they asked about only Ayushman Bharat scheme and their claim settlement issues, sir. Other than that, nothing was asked. They asked me about dentistry, what all procedures I do, and about self-introduction and parents background. That's it.
Keerthana, you'll be selected. Just be yourself, go and give. That's it. You'll be selected.
Thank you, sir. Thank you.
You are
for
a
that.
very good candidate.
Thank you so much, sir. But still, I feel anxious and nervous.
No. Don't be.
Now
Don't.
it's fine. It's fine.
You can meet Uma ma'am also. She is in Chennai NICL head office.
Yes, sir. When I saw the inaugurated webinar, I came to know the details. But I had a thought that I should get through this interview and I have to meet her in person.
Sure, we'll meet.
Sure, ma'am, sure.
All the best, Keerthana.
All the best. Good luck.
Thank you all so much. Good night, sir. Thank you.
Good.